With the increase in urbanization, high-energy food intake has increased while reducing physical activity. The new lifestyle also causes mental stress, leading many people to relieve it through tobacco consumption and smoking. But it's like embracing the worst solution to resolve a small problem. All these factors have caused a spurt in cases of heart attacks in India. An American research agency which studied coronary artery disease in Indians summarized that Indians have 2 to 4-fold higher chances of heart attack and death. Other observations say that Indians are more prone to attack 10 years earlier as compared to the rest of the world and have 10 times more chances of getting a heart attack under the age of 40 years. Even the severity of attack with complications and number of blocks in all 3 vessels of the heart is also higher here. However, not all heart diseases are heart attacks, but if it is a heart attack, a blocked artery is the culprit in most cases. This is where angioplasty comes to the rescue. Though angioplasty is a common surgical procedure performed by cardiologists worldwide, Dr. Rahul Patil brings a breath of fresh air to it. Since 2006, Dr. Rahul Patil is consultant intervention cardiologist in Pune. He completed his medical schooling from Pune University and undertook cardiology training in Hyderabad. He is one of the very few cardiologists from India to have completed his 12 years long medical education at the young age of 28 years. To top that, he was ranked first throughout his career. In 2008, he went to Tokyo in Japan to acquire advanced training in angioplasty and angiography and gained specialization in opening 100% blocks of more than 3 months duration, a condition referred to as chronic total occlusion. The following year, he did fellowship in international cardiology from the Netherlands, performing 250 cardiac procedures in just 3 months' time, for which he was awarded a fellowship. This new technique needs extra training, and very few professionals are proficient in conducting this surgery. That is why Dr. Rahul Patil is in a class of his own. He is also attached to major hospitals in Pune as a consultant for angioplasty and angiography. It is to his credit that in the last 6 years of his practice, he has carried out 2,000 angioplasties, 5,000 angiographies, 200 balloon valvoplasties, and more than 100 device procedures for heart patients. But there is more than numbers that make him an uncommon cardiologist. He is specially trained in doing angioplasty and angiography through the wrist. In medical parlance, it is called radial angioplasty, and even in an advanced country like the USA, only a minuscule number of cardiologists specialize in this form of procedure. Femoral angioplasty is the conventional method, wherein the angioplasty is performed through the groin. Dr. Rahul Patil's radial angioplasty scores over the conventional method in more than one ways. It involves making a small puncture in the wrist under local anesthesia. Procedure time is 2 to 5 minutes for angiography and 20 to 30 minutes for angioplasty. It is a safer procedure because the puncture site can be bandaged on the hand and chances of complications like bleeding and hemotema are much lower. On the other hand, in the conventional method, the patient lies facing up on the bed for 2 to 6 hours. Feeding, movements and urinating have to be done in a lying position. It also adds up extra cost to the patient. As the patient is in and out of the hospital on the same day and may return to work after a few hours or at the most the very next day, for most, radial angioplasty is very simple. In June 2011, he started Hridayam Heart Care Clinic, which is centrally located and accessible from all directions. Since a routine checkup for all heart ailments involves a long list of tests, which takes up an entire day of the patient and the relatives, his clinic is fully equipped and has all the facilities to conduct various tests without putting the patient to additional stress. The ultra-modern equipments available at Hridayam Heart Care Clinic include 2D echocardiography and color Doppler, treadmill test, Holter monitoring, ambulatory BP, among others. Blood tests that can be performed in his clinic include fasting lipid profile for cholesterol assessment, fasting blood sugar, HbA1c, HS, CRP, lipoprotein A, that is, serum homocysteine. All of these tests help in assessing whether the patient is at risk of getting a heart attack. While these tests are done in different departments in any tertiary care hospital, thereby consuming almost a day, they can be completed in less than 2 hours at Dr. Rahul Patil's Hridayam Heart Care Clinic. Dr. Rahul Patil is of the opinion that after the age of 30 for males and 35 for females, people should undergo heart checkups to prevent heart attack at a young age. In order to drive this message home, he is conducting a mass education program at various levels by involving corporates, NGOs and the society, the general public as well as doctors. He recently addressed the whole of Maharashtra on Sam Marathi television channel on the issue of heart attack at a young age, which was highly appreciated and well accepted by medical and non-medical people alike. In doing so, Dr. Rahul Patil hopes to play a major role in preventing heart attacks at a young age in the Indian population.